it's been almost 3 months since authorities in England declared freedom from pandemic-related restrictions, but their fight against COVID-19 infections continues. Now, for a glimpse of the situation there, I have Dr. Mark Jitt at the London School of Hygiene and Tropical Medicine. Dr. Jitt, it's a pleasure to see you again.
Great to be here.
Right, now, Dr. Jitt, the UK recorded over 40,000 new infections last Thursday for the first time since early September. And again, this past Monday, the daily tally hit above that level. What more can you tell us about the COVID-19 situation there?
I think the number of cases in the UK has been pretty stable since July. There's been about 30 to 40,000 cases every day. The surprising thing is not that it stayed high, but that it hasn't gone up further. The reason is because in July, almost all COVID restrictions in the UK were lifted. So there are almost no restrictions on, going out, on economic activities, on mass gatherings, on face coverings, and so forth. So I think the reason cases haven't gone up despite the removal of all restrictions is really because of vaccination, because of the fairly high vaccine coverage is what is preventing cases from increasing. But since we've gone back to almost like a pre-COVID levels of restrictions, I think that is what's stopping the numbers from going down. I'd add that the number of deaths is well, it's lower than it's been with previous waves, and that's because most of the older and most vulnerable people have been vaccinated with 2 doses.
Right. And talking about vaccination, Dr. Jitt, healthy children aged 12 to 15 over in the UK are being offered 1 dose of the Pfizer vaccine since late last month. Now, what is behind the decision to offer a single dose to those in this age group?
Well, the reason for that is there were some risk calculations done on the individual risk of the individual benefit from vaccination versus the risk of a very, very rare possible side effect of vaccination in children, which is myocarditis. I would stress that this is a very rare event. There's less than, like maybe 1 case per 100,000 or even less where this happens. But if you base it on individual risk calculations, then the first dose gives the most benefit and has the very, very low risk of myocarditis. The second dose gives less extra benefit because most of the protection comes from the first dose, and then has a higher risk of myocarditis. I mean, I do want to stress this is a very rare event, and the calculations that were made don't take into account other benefits, which I think possibly governments might also want to consider. For instance, helping the adolescents, the teenagers who get vaccinated, preventing them from missing school if they get sick or their friends get sick, preventing transmission in the community, preventing so-called milder cases of COVID, which can still be quite severe in some cases and maybe lead to long COVID. So I think if you take those into account, I can see why other governments have recommended 2 doses.
Right. Meanwhile, Professor Kim, as part of efforts to ensure a gradual return to normality, authorities here are expanding at-home treatment. Now, for those who have mild or no symptoms, what can be done to further support this treatment at home?
I guess some patients will welcome that decision to let them stay at home, and some people might be worried about their health situations. And for the patients, I mean, they should be compliant. I mean, they should follow the rules that the government is giving for their quarantine measures. And if the patient have some kind of comorbidity, or if the patient is in a situation needing a caregiver, we have to think one more time whether to let the patient stay at home or rather do as we did previously. And I guess they might need some kind of personal equipment which they can use at home, such as a small device checking the oxygen saturation, which is very cheap and available right now. For the government side, I think they have to use the beds available. I mean, we have a network of facilities that communicate to admit patient, and it should be work very efficiently. Sometimes it doesn't work out pretty well, but if more patients going to happen, and if they have to stay at home, and somebody might get worse, and we have to be ready. So more beds should be available.
Right. And Dr. Jit, what can you share with us about making effective use of at-home treatment, which I hear is an active option over in the UK?
Yeah, well, the policy on home treatment has been the policy actually since the beginning of the pandemic, almost the beginning of the pandemic. Most, well, cases of COVID are recommended to self-isolate at home and only to seek care if they have, well, they're supposed to monitor their own symptoms and then to seek care if the symptoms worsen. The reason for this is the vast majority of cases of COVID will improve without any hospital treatment. So this both allows patients to self-isolate at home and prevents the hospital facilities from being overwhelmed. So yeah.
Right. All right, Dr. Jit, as always, thank you for making the time to join us live at this very early hour at your end.
Great to be here. Thank you.